Joyce Marshall is the Director of Maternal Child Health Service at the Oklahoma State Department of Health. You can read a bit more about her in a lot of the information that Sarah sent out that has bios of all of our speakers today, but we're very excited to have her here. She's a huge support for all of our breastfeeding efforts and a huge champion for breastfeeding in the state of Oklahoma. And I will turn it over to Joyce to recognize our one of our hospitals today.
Thank you, Becky. What a great leader Becky is for becoming baby friendly in Oklahoma. I don't know how we would do this without her. And so thank you for that informative presentation and for the great opportunity I have now. And that is, good morning, everyone. I am so pleased to have the opportunity to recognize Oklahoma's baby friendly hospitals today. The Baby Friendly Hospital designation is an international recognition earned by hospitals who have implemented exemplary breastfeeding policies and practices. Baby-friendly designated hospitals have demonstrated best practice in the care of mothers and newborns, and in the process have improved their breastfeeding rates by giving mothers the information, confidence, and skills necessary to successfully initiate and continue to breastfeed their babies. This achievement is the gold standard, the highest designation afforded to hospitals by an accrediting body that promotes best practices for maternity care. Every baby-friendly hospital has implemented the 10 steps to successful breastfeeding and follows the International Code of Marketing of Breast Milk Substitutes, providing mothers and babies with the early support necessary to achieve successful breastfeeding and setting the stage for a healthy future. By providing support for Oklahoma's delivering hospitals to achieve baby-friendly designation, Oklahoma has established itself as a leader in promoting the very best care for babies and families. So why is the baby-friendly designation so important? It reduces disparities. Data from several southern states participating in the Communities and Hospitals Advancing Maternity Practices initiative found that increased compliance with the 10 steps was associated with a decrease in racial disparities in breastfeeding. The disparity in breastfeeding initiation between Black and white babies decreased by 9.6 percentage points over 31 months. It also increases breastfeeding initiation and duration rates, which improves the health of mothers, babies, and children. For moms, that means less hypertension, type 2 diabetes, ovarian and breast cancer. For babies and children, less diarrhea and vomiting, asthma, type 1 diabetes, stomach and respiratory infections, less SIDS, and less risk of overweight and obesity in childhood and adolescence. Also, having an outside assessment demonstrates to the public that a designated facility consistently provides this level of quality care. And as Becky said, almost 32% of Oklahoma births now occur in our 10 Oklahoma baby-friendly hospitals. That's higher than the 28% of US babies born in baby-friendly hospitals and higher than the national average. It's really awesome news. We've come a long way since 2013, when our first hospital was designated and only 7% of US babies were born in baby-friendly hospitals. We've now more than quadrupled that 2013 US number. And now it's my distinct honor to recognize Comanche County Memorial Hospital in Lawton as Oklahoma's second baby-friendly hospital to achieve global redesignation. Congratulations. I think you can see all the congratulations throughout in the galley.
Joyce, if I can interrupt for just a second. I know Kate Copas and some others from Comanche County, do y'all just want to unmute yourselves and say hi? Let us know you're out there so we can applaud you.
Yes, please. We would love to see you and applaud you.
Just unmute and introduce yourself. How many do we have from Comanche County that are on today?
I think we have probably 7 or 8 of us.
Awesome, awesome. There's Kate. And for those of you that may not know, to get redesignated, the hospital goes through all of the official external assessment process, just as they did the first time around. And y'all snuck in pre-COVID, right?
Yes, we did. About a week before.
Just barely. So, okay, back to you, Joyce.
Okay, just again, you did that, yes, occurred in March, coinciding with all of the COVID efforts and responses. So we can't say enough about the work that you've done in achieving this global redesignation. To the Comanche County Memorial Hospital team, your commitment to excellence is evident, and the diligence and dedication you've demonstrated in achieving this redesignation serves as an example and inspiration to all of us. Congratulations again.
Thank you.
I'd also like to recognize the rest of our baby-friendly hospitals who continue to provide this level of quality maternity care for their mothers and babies. Claremore Indian Hospital, Integris Baptist Medical Center in Oklahoma City, Cherokee Nation W.W. Hastings Hospital in Tahlequah, Integris Health in Edmond, St. Anthony Hospital in Oklahoma City, Chickasaw Nation Medical Center in Ada, Hillcrest Medical Center in Tulsa, Integris Canadian Valley Hospital in Yukon, Children's Hospital at OU Medicine. So thank you to all of our 10 baby-friendly hospitals. We appreciate your ongoing efforts to promote maternal and infant health as part of Oklahoma's efforts to reduce infant deaths and mortality. Again, thank you. We'd also like to recognize 3 hospitals in the final phase of their baby-friendly journey: Duncan Regional Hospital, SSM Health in St. Anthony Hospital in Shawnee, Integris Southwest Medical Center in Oklahoma City. We applaud your continuing efforts and look forward to your designation. Many of our delivering hospitals have participated in some project activities, but haven't yet committed. So we want to encourage all to join Oklahoma's baby-friendly hospitals in demonstrated leadership and best practice. These hospitals receive guidance, in-person staff training, and online training discounts, national recognition, and assistance with fees. And finally, we'd like to recognize our partner organizations for their ongoing support of the Becoming Baby Friendly in Oklahoma project and the Preparing for a Lifetime. It's Everyone's Responsibility initiative to reduce infant mortality in Oklahoma, including the Oklahoma Hospital Association, Oklahoma Healthcare Authority, OU Health Sciences Center, Oklahoma Perinatal Quality Improvement Collaborative, Coalition of Oklahoma Breastfeeding Advocates, and the Oklahoma Breastfeeding Resource Center. We thank you and applaud you for your efforts to support Oklahoma's families. Thank you so much for all you do. And again, congratulations to Comanche County Memorial Hospital on their global redesignation as a baby-friendly hospital, and to all of our 10 baby-friendly hospitals. Thank you.